and funded by Comic Relief, UKAID, Citizen Foundation, the CDF, and Doctor. So we are addressing the invisible struggle, exploring workplace, mental health, civil society organization, learning institution, and health facility in Kisumu. So those are staff from Kisumu Special Hospital. I was giving them some CME, and it was all about patient-centered care, but they said, why don't you have something for us? So, yeah. So after this, we are going to recognize the unmet needs of the social intervention in workplace, understand the component of workplace mental health intervention of immersion program, acknowledge the challenges or the lack of mental health services at workplace. So immersion mental health initiative, we had 42 projects, 42-month projects started from May 2020 to October 2023. Actually, it soon will be out of work because the project is over. And it contributes in improving mental health, workplace, and well-being. Those are staff from a prison, whereby we were talk to them because they felt that these young people, most of them are below 25 years of age. So the management called us to talk to them because they felt that they have a lot of time on their hand and they have money and they do not know how to spend the money. And because they report to work at 8 in the morning to 12, and then they have to report again the following day in the morning. So because they have a lot of free time and they have money, they indulge in other risky behaviors like alcohol, just hanging around, not investing in themselves. And some of them, they were contributed to go to these places by the family members, so they are forced again to give back to the community. So that small money that they have, it's putting too much pressure on them that they have to support their big family, that they're remaining with nothing for themselves. So we're working in the workplace. There was people were complaining about the stress and depression, isolation and loneliness, workplace balance, career development, and clear expectation at workplace and conflict, micromanagement and lack of recognition, bullying and harassment, physical health, lack of flexibility, and the context is work-led and tight deadline leading to them to burnout and negative anxiety. And clear expectation, career development led to lack of recognition, to isolation and loneliness. Micromanagement led to the poor management, hence poor physical conflict. A lack of flexibility, generational gap is a factor that affected majority of employees at the time that is encouraging bullying and workplace. And here, what was really nice, or rather what was interesting, the generational gap was where you find millennials and the Gen Zs. Gen Zs are coming in with those attitude of like, we know better, we are bringing something new. So you old people, kaeni kando. So the older people in the workplaces felt like the Gen Zs are not really there to learn, but they are there to show them that we can do better than you. Yet the older ones were feeling like the Gen Z are coming too fast, and they are already seeing that there's going to be a problem ahead there. And because there's that miscommunication between the two, they created a lot of loneliness because everybody has their own places. The older people also felt like the Gen Zs are coming in with new ideas, good ideas, and so they risk losing their jobs. So there's that competition, and everybody's trying to backstab the other. So some people feel like they don't part of it. Some felt like as if they are being bullied or they are being harassed. Those who are in micromanaging their places, they always complain of having too much work. But if you sit down with them, you ask them, how best can we do them? We just come to find out that actually if they can give other people responsibility, then it becomes easier. And so we managed to talk to them and tell them just on how they can tone down on micromanaging places of work. And as you realize, micromanaging, of course it creates a lot of lack of recognition because you're just one person trying to do everything. So you are called in all the meetings. You don't give other colleagues time to even to attend the meetings, attend conferences, attend, those other things that they can build their careers. So it is this one person who is the manager or who is favored by the manager who keeps going in almost all the places. And so the other people are feeling like as if they are not really part of it. When it comes to unclear expectation, they were saying that some of them, they had culture shock. You are from college, you get a job, and you're like, whoa, I didn't expect this. So there is that, by the time they realize that, by the time they get themselves in a place where they can manage themselves, somebody else have overcome and overtaken the time and the spaces. And so they feel like this is not what I really wanted. And as we know in Kenya, most of the time, majority of us have gone to college to do what we did not want to do. So yeah, you get a job and you're like, this is exactly what I did. I do want to do this. So when you go there, you're no longer a student. You are a staff. You are expected to give results. You're expected to have goals. You are expected to earn your salary. So when you think about your salary and the job you're doing you don't like, it brought a lot of conflicts and mental health conditions. So the methodologies that we used one-on-one interviews, focus group discussions, and semi-structured questionnaires. Zedi earlier had yesterday presented on schools most of the time. I think you all learned. And the reason why we actually even went to workplaces is because of the students that we were dealing with. They were telling us, I'm going through this, but don't tell the teacher. I'm going through this, but don't tell my mother. So there's no way you could actually go and tell the teacher, this kind of student is telling us this and this and this. That would have created a lot of conflict. So what we did, and we took them through the mental health knowledge and awareness. And most of the time, we will always bring in the first on self-awareness, whereby we tell them, do you know yourself, your personality? Do you even know how to work with other people? Why do you feel you're so angry? Why do you feel you need like a child needs to be beaten to understand something? So when we had them together in one place, we managed to take care of what those other students told us about their teachers without really actually pointing at them. At the same adolescents and the teachers that we're working with, at home in the community, they tell us what they go through and they tell us, don't tell my mom, don't tell my dad. So what we did, we go to the workplaces, in places where they work, and we bring in the topics that the students were bringing on the table, and we're just trying to make them understand what is it to deal with a student, what is it to deal with adolescents. And because now, if you have a child who is probably having behavior disorder, you even as a parent, you cannot work at peace. Imagine being called to go to school each and every time because your child has behavior issues. So because of that, we managed to go to workplaces and managed to talk to the parents in that area as well. So a sample, those are the key indicators. We reached eight institutions, and we reached 200 employees, and the success rate was 95%. The teachers from 4 schools who are given mental health awareness or relevant to medical breakdown, because in teaching you have 60 students whom you have to take care of. So it reaches a point whereby you only concentrate on the students who are doing better. Wengine katikati, let them deal with their own. And we don't want that. We want everybody to be reached by the teachers. So the teachers you feel a little bit breakdown, and we also went to tell them that you do not have to handle the cases. You call upon us, and we are going to come and help you deal with the students as you are dealing with your mean grades. We reached 1 private health facility, and 1 prison staff were reached that I showed you, and then 2 civil society that we targeted, and success was determined by the number of individuals seeking psychosocial support services. And here we created a platform, we created an online platform where you can just click in and do your own self-assessment, and then it teaches that because it's also tailor-made. So these are the findings. Most of them complain about depression, PTSD, anxiety, and low self-esteem. 70% of the people that we reached prefer online sessions, time, of course, stigma, and distance. This is our strategy. We meet with them, then we do diagnosis, then they need to go for evaluation, we refer them there. If we continue with them, we do monitoring and response, we follow up, and then we do a case as a team. Conclusion, bigger organizations are not likely to notice and report mental health cases. The risking the organization to bear losses on productivity due to frequent absenteeism, high staff turnover, and possible redundancy. Number 2, self-discrimination and stigma, lack of awareness made some of the staff keep off from themselves for fear of being judged, monitored, laid off, or even discriminated upon. Nobody will want to have somebody tell them, I think I have a mental health issue. So when they go to the hospital, they will use a disease before they reach it to us. Lack of mental health policies. Staff will not know where to get mental health policies since policies are not in places to protect the guy and guide them when it comes to mental health issues. The recommendations, Individually, we give them tips on taking care of themselves, setting boundaries, and seeking support. In managers, we promote balanced work and regular checkup, training and educating on mental health, creating supportive system, and also we realize that most of the people who are on the top do not know what the other people down here are going through. So from their feedback is what we managers so that they can be able to take care of it. And managers who are also micromanaging, we're also trying to tell them on how they can manage themselves so that they don't have to affect themselves and also the people that they're working for them. Then for the organization, we told them that it is just important to implement mental health policies and programs, flexible workplaces, job sharing, and remote work options. I mean, we did it during Corona, so it shouldn't be a very big deal. Anti-stigma campaign, training for leadership, work on feedback, and addressing mental health stigma, discrimination, and bullying and harassment. And all of us know when we are called in a meeting and we want to address the feedback, most of us just know, nothing much will be done. Almost all of us have gone through that in our different workplaces. And yeah, we are finishing. So this is the team that we work with, and these are what they're saying. That is Gentrix, he's a psychologist. Also, she said, we are impressed with the safety and effectiveness of a mental health workplace. It will greatly benefit the staff. We have Whitney who said, I have seen significant improvement on patient outcome. Mental health workplace breakthrough makes treatment more effective and personalized. For her, she works at Kisumu County Hospital with the psychiatrist of that place. And our intern, whom we just adapted, said employment should provide training and resource to raise awareness about mental health, reduce stigma, and help employees recognize the signs of mental health in themselves and in their colleagues. We have Martha based at Jaramogi Oginga Odinga, maternity. She deals a lot with people who are dealing with alcohol. She's offering support services in the hospital setup, has made me realize how majority of people who come to examination are actually battling conditions related to workplace stresses. And here I am, I say all workplaces should have mental health policies that safeguards its employees. Thank you very much.